Hello, everyone, and welcome to the TMA Ask the Expert podcast series. Today's session is entitled Support for Caregivers, How to Cope When a Loved One is Diagnosed with NMO, ADEM, or TM. My name is Rebecca Bishop, and I'm the Research and Project Manager at the Transverse Myelitis Association. We are a nonprofit focused on support, education, and research of rare neuroimmune diseases. You can learn more about us on our website at myelitis.org. We're pleased that Sam Huge from UT Southwestern in Dallas, Texas, is joining us today. Before I turn it over to Sam, a few housekeeping pieces. This podcast is being recorded and will be made available on the TMA website at myelitis.org. During the call, if you have any additional questions, please send them to us via our Facebook page at facebook.com/myelitis. Sam, could you start us off by introducing our speakers?
Thanks, Roberta. I'd be happy to. I'm honored to be guest hosting this podcast today, and I'm pleased to be joined by Audrey Ayers, Catherine Treadaway, and Sandy Siegel. Audrey Ayers completed her Bachelor of Science in Nursing at University of Texas Medical Branch in Galveston, Texas, and she began her career in the Surgical Intensive Care Unit at UTMB and continued working in transplant and cardiothoracic surgical along with cardiovascular intensive care units. Audrey joined the Multiple Sclerosis Center and the NMO and TM centers at UT Southwestern in February 2012. She's the clinical nurse coordinator for the Pediatric Demyelinating Disease Clinic at UT Southwestern and Children's Health in Dallas, and has a special focus on creating effective tools for adolescents and their families to transition to the adult healthcare system. Audrey was recently selected by D Magazine in Dallas and presented the 2014 Excellence in Neurosciences Nursing Award. Catherine Treadaway received her bachelor's degree in sociology and Master of Social Work at Louisiana State University. She received her board certification in 1998 from the Louisiana State Board of Certified Social Work Examiners. Catherine has been at the Multiple Sclerosis Program at UT Southwestern since September 2002. She works with a dynamic multidisciplinary team in the MS Clinic and the Pediatric Demyelinating Disease Clinic, participating in research and patient care. She assists patients by serving as their advocate, locating resources, providing counseling, support, and information, and arranging home and outpatient care. She also assisted in the development of the Total Life Care Clinic, a clinic within the MS Clinic, as well as participates in this weekly multidisciplinary clinic for at-risk patients. Sandy got involved with the TMA shortly after his wife, Pauline, contracted transverse myelitis in 1994 at the age of 35. At the time of her onset, Pauline was a kindergarten teacher. Currently, she's a fourth-grade teacher in a public school district in central Ohio. Sandy has been an officer and a board member of the TMA since its inception. Sandy has also served as the TMA's newsletter and journal editor during his almost 2 decades of service to the organization. Sandy is a cultural anthropologist by trade with specializations in Native Americans, psychological anthropology, and culture change. And thanks to all of our experts today for joining us. And thank you to all of our listeners for joining us as well and sending your questions in advance. I'll do my best to get through the questions as possible and hit on some topics for everybody to think of. But to get us started off, I wanted to start off with Sandy here to give us an overview of his time with the TMA and how he got into it and how he and Pauline have worked over the years dealing with the transverse myelitis.
Thank you, Sam. And it's a pleasure to be involved in the podcast this afternoon. As Sam noted, Pauline and I unfortunately got involved in this endeavor when Pauline got a transverse myelitis diagnosis in 1994. And at that time, there was no doctor who specialized in TM. There was no association. There was no information available to the lay community. There was really very little involved education available for physicians or medical professionals. And because of that, we really had to learn everything on our own, in our own way. And it was really because of the experience that we had being so alone and having very little information and no support, that we got involved in starting the Transverse Myelitis Association. And we had really no experience or training to provide us with any tools to engage in this journey. This has been a learn-as-you-go proposition. And I'll say that really my work for the association is really so closely associated with my work and my livelihood and my passion for being a caregiver for Pauline. The job oftentimes is one and the same. And I had no experience or training for that job either. That has been a learn-as-you-go experience as well. And so, as I noted, it's been a journey, and here we are 20 years later, Pauline having transverse myelitis for 20 years and are being involved with the association for 20 years.
Mm-hmm. Thank you for that overview, Sandy. That was it's very great to have people like you who are through the trials and tribulations that come with diagnoses like this to come out on top and want to help educate others in the process. And some of the questions that have come up from the community have been from caregivers who are asking questions about how to help their loved one with transverse myelitis or another diagnosis manage some of their issues. And maybe Catherine and Audrey could help answer some of those questions. And Sandy, if you have any anecdotal experience with these things, I could help as well. There was a question about managing bladder incontinence, and the question is about buying adult diapers that are very expensive, and their loved one, the brother who has TM, gets UTIs very often. And are there ways that they can help prevent the UTIs from happening, or ways to get adult diapers in a better way? Audrey and Catherine, do you have any suggestions or advice for someone with that issue?
Hi, it's Audrey. Yeah, so it's kind of a multi-step question here, and so just kind of tease apart things a little bit. So in terms of preventing UTIs, there are a few things that can be done. The first thing that I always suggest if we're having recurrent UTIs is just making sure we have a good partnership with a urologist, so that if we need to do things like urodynamic studies and other things, that we can get trained up, get that those tests in order, and if we need to change medications or different things, we can do that. The other thing is making sure that if we are using any kind of catheters at any point, that we have good training and that we're assessing our technique to make sure that those things are being done appropriately and cleanly. Now, when we're talking about care for preventing, of course, hydration is huge. We want to make sure that every day that that is a priority, to make sure we're getting enough fluid intake to flush out the area. And we can do things like supplementing with cranberry juice or Allura, which are cranberry pill supplements that can be helpful to make sure that things are very acidic. And those things, along with proper technique and other making sure we're on the correct medications and things like that, may be able to help prevent them in the future. Occasionally, daily antibiotics low antibiotics are necessary to help prevent that as well, and that would be a conversation with the urologist that would be helpful with that. Catherine may be able to help a little bit with the DME or getting supplies and making sure that we get enough of those. It is sometimes restricted depending on different insurance companies. And so sometimes we have to reach out to some partners to help with that. Do you have anything to add, Catherine?
Yeah, this is Catherine, and I would suggest, usually catheters are paid for by insurance, but as far as the pull-ups and pads and things, those can be paid for through Medicaid if someone's eligible for Medicaid. But if you're not, I would suggest calling wherever you live. You can generally call 211 to get information for resources in your community. and you could just ask them, is there any place, like here in Dallas, we have this place called the DME Exchange where people donate equipment. They donate incontinence supplies as well, and so you can just call them, and if they have it, they're happy to give it to people. So, again, you could call 211, and it's usually good in every state. You dial that number, and it really tells you about resources in your community overall, too. But you could ask them if there's any particular places, like maybe churches or the Salvation Army or certain places like that that might carry or have some of those.
Mm-hmm. That's very informative. Thank you. There's another question that was posited regarding information, where one can find information that they can share about the diagnoses or how to what to expect from these diagnoses of TM or NMO with institutions like schools or workplaces or things of this nature, so that we can, whether it be our children or our spouses or whomever, can still be in the workforce or in school and not have to have people be educated about their diagnosis. So there are different resources that can be utilized to give to people who wouldn't otherwise know anything about these diagnoses.
I can jump in if, but really I think one of the best resources we have is myelitis.org. They've done an amazing job not only breaking down the different diagnoses and talking about all of the different pathophysiology, potential symptoms, the way that the disease processes can kind of come and go with certain aspects of them, and it's a great resource. And I know that there are other groups, too, that have guides and other things that can be helpful. For example, some of our groups have school guides for them. Another good resource is the local rehabilitative services in terms of finding assistance and information for how to get into the workplace and find counselors to help connect the right people with the right professions or representation when they are going back and dealing with work. But I think the Transverse Myelitis Organization has done an amazing job being able to clearly talk about the diagnoses, and so that we can share that with our workplace and our school. Catherine, do you have anything to add?
Well, I was just thinking it's a personal decision if you decide to disclose your diagnosis or not. I think working with a vocational rehab counselor in your state, usually here in Texas, the services are free, and they provide assistance to anyone who has any kind of disability to either stay employed, whether that means getting accommodations or finding work, and helping you with building your resume or even getting clothes to interview in. I mean, they do all kinds of amazing things. Put lists on cars so that you can get to work. And then there's a really great website called the Job Accommodation Network, and it's through the Department of Labor, and it gives you, there's all kinds of accommodations for different illnesses, and you could look at the one for MS or just anything that's similar to TM that would give you some ideas of things that you could request from your employer. But just remember, they are not required to provide that accommodation unless it's reasonable and not a hardship on them. But in my experience, I feel like usually employers work with us and our patients, and certainly work with your physician as far as helping request those accommodations. You know, we can work with the rehab counselors. They can give us advice on what we want to ask for and how much we want to disclose.
Catherine, do you know, does every state have an ADA office? Somebody who's responsible for implementing the Americans with Disability Act in their state? Do you know?
That, I would think it would go through to the Department of Assisted and Rehabilitative Services. So whenever there comes up an issue, I usually contact them if we're having difficulty with employers, because they will gently remind the employees of what they are obligated to provide as far as under the ADA.
And I believe that is the case in Ohio, that it's a office in the Vocational Rehabilitation Services Department, the State Department. And they are an excellent resource. If a person has issues in the workplace or in school, and they're confused about what their rights are or what sorts of expectations they ought to be able to have in the workplace or in school, they can be that ADA officer for the state can be an excellent resource to help get information about the law.
Yeah, I agree. And I think a lot of colleges, we work with their student Office of Disabilities and request accommodations, usually for things like extra time to get to class or extra time for projects or test-taking time, things like that. And they usually will work with us. And then as far as the school, we provide letters and things from our office for anything that the child needs.
And I think to reiterate what Audrey was saying about description, if you're needing to provide information, and again, as Catherine noted, these are sometimes difficult decisions for people as to how much they want to disclose to an employer, for instance. But if you are in a situation where you're trying to describe to an employer or to a school district what the nature of ADEM or NMO or transverse myelitis might be, there's just a tremendous amount of information on the website. There's, for instance, a really excellent overview article that was printed in the New England Journal of Medicine on transverse myelitis. It's reprinted in one of our newsletters, and it gives a really good overview of all the symptoms of transverse myelitis, and it's done so in a pretty generalized way, so it's not too complicated. There's a lot of information like that it would be very easy to print out and to provide to either a school district or an employer.
Mm. Yes, and while this next question kind of was answered in part by everything that was just said, but maybe you can speak to the other side of the coin on how you evaluate information or advice you might find on the internet. Well, we know that the good advice comes from myelitis.org, but when someone you love is diagnosed with TM or NMO and you Google it, how do we really know what we should pay attention to and what we shouldn't pay attention to?
Well, that's a very complicated question, and there is a pretty complicated answer to that. But I'll try this. It's all about knowing who's putting the information up on the on a website. I can, with very little restriction, say anything I want to say on a website. I can make claims about, eating so much garlic every day is going to cure this, that, and the other thing, and there's very little to restrict that kind of information or to hold a person accountable for it. So that really puts the consuming information public in charge of having to figure out what the veracity of that information is. And for me, it sort of starts with who put it up there and how qualified are they to make the claims that they're making or to present the information that they're presenting. And in the case of these rare neuroimmunologic disorders, that is a challenge because there really is so little published in the medical literature that is based on scientific studies. So most of the information that we have coming from the medical community is based on expert experience and expert judgment, which is why it's so important to have people involved like Dr. Benjamin Greenberg and Dr. Carlos Pardo and Alan DeSena, because they are developing that experience, and we rely on them for so much of the information that we have on the website. It's also, if you go to the websites of different medical centers like UT Southwestern or Mayo Clinic or Johns Hopkins or Cleveland Clinic, you can be assured that they don't have information on their website that doesn't have a pretty good basis in either experience or science. So it's really about evaluating the organization or the individuals who are responsible for putting the information up on a website. And sometimes you don't know who put the information up there or the organization. It's probably a really good idea if you can't trace back the information to an organization that you can evaluate or an individual that you can evaluate, that you not take it very seriously, because that is how you evaluate the nature of the information, I believe.
Audrey or Catherine, do you have anything to add?
Well, I would just add for patients and their loved ones to not get obsessive about looking at the internet, because not all the information is going to pertain to their particular situation, and I think that can just create a lot of worry and fear and get people into a big frenzy about something that really may not even pertain to them. So I would just exactly what Sandy's saying, just check the accuracy of your information, check with your nurses and doctors. You know, if it sounds too good to be true, it might be too good to be true. And maybe just get a list of trusted websites like the mylitis.org. That you know has trustworthy information, and just be careful of hidden agendas with these websites.
Mm-hmm.
And that's the other element of this, is that there are people who are really suffering with the symptoms of these disorders and suffering for very long periods of time. And that suffering really drives people to feel very desperate about finding answers. And I'm never confused why people are searching and hoping for cures and fixes for things that unfortunately right now don't have an easy fix. And they're prone to being open, I think, because of the suffering and the suffering they're seeing their loved one experience, being open to treatments or claims that they should, maybe under different circumstances, they would be much more dubious about. So it's a good thing to keep in mind that sometimes understanding what is driving you to find some of these answers might help you to back away from some decisions that might not be in the best interest of either you or your loved one.
Mm-hmm. It's all very good information, things that we should take to heart as we look up any kind of information on the internet, regardless whether it's about these diagnoses or any others, or any kind of information, be able to validate where the information is coming from. I wanted to shift gears a little bit for the second half of the podcast for really the topic at hand here. And I thought it was interesting reading some of the questions as they came in that the topic of today's podcast is support for caregivers, but the questions that were predominantly asked were from caregivers about how to better support their loved one with the diagnosis. And I think that that's pretty telling as to why podcasts or educational or conversations like this are important, because many times when you are the caregiver or the loved one of someone with a hard diagnosis, you put yourself last, and you are very compassionate about your loved one, but can be not as compassionate about yourself. And I think it's important for we all as advocates to recognize that fact and to speak to it. And I was hoping maybe, Sandy, you could start off a little bit of a conversation with whatever you're comfortable with discussing about your experience as the spouse of a patient with TM, and how you felt moving forward and going through the journey that you've had with Pauline.
Well, like I started out saying, it's been a learn-as-you-go experience. And again, I had no particular training for the job as a caregiver or my work for the association. How I would characterize my experience with Pauline as a caregiver would be that for the first 2 years that Pauline had transverse myelitis, I had no life, and I was totally sucked into the making sure that Pauline's needs were taken care of from a medical perspective as her, partner. We had 2 young teenage children, so I was taking care of a house. The whole thing was a totally overwhelming experience, and I would say that in those first couple of years, I totally lost me. There wasn't time for me. Me was not an issue whatsoever because the urgency and the overwhelming nature of the things that were going on with Pauline pretty much didn't make me feel like there was room for anything about. I stopped seeing friends. I stopped engaging in any kind of social activity or entertainment. I used to love to play golf. My golf game was gone. I mean, I really had no life in those first 2 years. And it's not like in the 3rd year I found a life. I didn't. It has been a long and I think in some ways a pretty difficult process to get to a place where I started getting back me again. And I should say started getting back me and not feeling guilty about it. Because in a way that is part of the problem with getting back to being able to enjoy your life again, because frankly, that's a difficult thing to do when you have a partner that you care about so deeply and love so deeply, whose suffering is ongoing. I mean, Pauline has horrible nerve pain. All of you know what she has. She's got what all of you guys have. And it's very hard to watch somebody suffer like that and to be able to say to yourself, I feel really horrible for this person, and I'm going to do everything I can possibly do to help this person. But at the end of the day, this is the only life I get. And so I have to make the most out of this for myself, too. And what kind of life am I going to have if I give up everything for another person? That's a tough thing to say to yourself, but I've said it to myself, and I've tried to carve out a life again on the other side of this thing. That is a 30,000-foot explanation of my journey.
That's thank you for sharing that. That's very strong. That's very strong to hear that story, and I think that there are a lot of loved ones in your position who have been in your position and now in your position who can relate to that. And I was wondering if Catherine and Audrey, if you might take the lead from the other side of the coin as the healthcare professionals who are not only taking care of the patients with TM and NMO and ADEM and these diagnoses, but also taking care of the families many times, and what kind of recommendations or suggestions, or just even things to think about that caregivers, parents, and spouses, and siblings of the patients really to think what they can think about and take away with.
Sure. Yeah, this is Audrey. Just kind of jumping back in. To me, the thing that we have to make sure that whenever we are, helping a patient who has, TM, NMO, these things, that we as caregivers have to realize from the medical side that it's a holistic approach. And so we are not only just taking care of the person who is our patient, but the whole family. And so just having that perspective coming into visits or on the telephone and different things like that just kind of helps shape the way we have conversations and we check in. I've had many a conversation where we kind of talk about, remember, if when they give the instructions on an airplane, if the airplane is going down, we have to put the oxygen on ourselves before we can put on the next person. So a lot of times we have to have the conversation of, you, the caregiver, need to make sure that you're taking care of and helping yourself first, because without those things, without having your own life, without, have you gone to the primary care doctor recently? Have you had fun and a joyful time? Without those pieces, it can build just fatigue, burnout, sometimes bitterness, resentment, and different things that was never the intention from the get-go. And so a lot of times, we have conversations even separately with them just to kind of make sure that, hey, are you taking the time to make yourself a priority as well? And a lot of times I hear just kind of like relief that we're willing to have the conversation. And, just these feelings of guilt, like Sandy was saying, or just like, I can't do it all, or, I should be able to do these things, or I didn't know, or why didn't I call about these things? And it can be it can be limiting to them instead of being able to find some more balance in different things. And so we've kind of bounced around some strategies, and I want Catherine to jump in too, just to kind of give her perspective from the social work side, and we can kind of talk about some things that we suggest for the family.
Okay, well, a few things that I just want to touch on is, if your loved one's in pain, their social filter may be off, and, they may say things that they don't mean, and in turn, you may do the same thing as their caregiver. And I think it's important just learn to forgive yourself for that and move on, and just know that that is going to happen sometimes, when people are really ill and not feeling good. And I also think it's important to just be clear about your reality today, and don't get caught up in imagining things are worse than they are, or getting too worried about the future, and what's going to happen tomorrow, and just try to live in the moment. And also release yourself from expectations to be perfect, because we all make mistakes. We can't do everything right all the time. And, we all talk about compassion for others, and I imagine most loved ones and, our families, that they have a lot of compassion for our patients. And we appreciate that so much. And what I would like to see is for people to have self-compassion, and there's actually, Dr. Neff on her website has a survey that you can do to test your self-compassion. And then she also has exercises that you can do to help build your self-compassion. And then, I'd be happy to talk about some relaxation skills as well, that are maybe easier to do when you're at home and, that you don't have a lot of time. Even just taking 10 minutes for yourself a day to do some guided imagery, which there's a lot on the website. There's free imagery that you can get. There's books you can get. But I would suggest just checking it out. You can do a 10, 15-minute relaxation. And I think the quickest way to relax yourself is through deep breathing. And I try to remind myself of that too. You know, if I'm getting stressed out in traffic, I have a little lavender pouch that I breathe in, and just pull others in to help you. And if you feel, I would also watch out for signs of depression. If you're getting really overwhelmed and finding yourself sad and not enjoying things too, you know, go see your physician. You know, and just remember to, you know, you may have to find new interests, but try to keep those interests. And I know it's hard. I know that it's hard for people. And I'm in a similar situation. So, you know, I just do my best. You know, just you're doing the best you can because you love that person, and that's the best you can do. But try to watch out for yourself, even if it's just going outside for a little bit, if it's journaling, if it's prayer, or just some kind of mantra that will help calm you down. But the guided imagery, I think, is really good in lowering people's reactivity to stress. And it's something anybody can do. It'll take you 10, 15 minutes.
And I really want to highlight trying to pull people in. I think that the TMA has done an amazing job with the support groups and just having these places where we can all go and share just kind of what's going on so that we are not kind of in an isolated place. Some of these things are so rare that it can be overwhelming, and just if we are out on our own, just we feel like we're in an island. And so having others to just even talk to and voice, hey, I'm frustrated with this, I'm just having a bad day, and it's okay to have a bad day and to share with others. But if there's ways for people in your community or for family members to share with them and to bring them in to help and just say, I need an afternoon off. I'm going to go watch a movie or go get, you know, whatever that needs to be, and being free to be open with them and be honest. And because that's going to be really important to be able to communicate with those so that you're supported as you support someone else.
Yeah, and I'll just think about another about a person. She wrote a list of all her tasks, all her responsibilities. And then when people would ask, oh, can I help? She'd say, yes, here's my list. You know, what are you most comfortable with to take on this list? You know, and if you can get people in to help you with the yard work, the housework, do it. You know, and also just remember that your family and friends are going to process news about a serious illness at a different pace than you, and it may not be on the same schedule as you.
And I think so many of these issues, too, I think, are impacted by the age of the person who has ADEM or NMO or transverse myelitis. So if it's a young child who has one of these disorders and it's the parents who are the caregivers, oftentimes the relationship between mom and dad really suffers because they no longer have time. I mean, it's hard when you have children to keep that relationship maybe at the level you would like it to be with your social and your romantic relationship with that person. But if you have a child who has severe symptoms from one of these disorders, it can really take a hit. And I think it's important to recognize that relationship needs work, and there has to be some energy to you know, and hopefully it doesn't always feel like work, but their effort has to go into that relationship, and that requires sometimes having other family members step forward to help you so that you can have time with each other. If it's, you know, an adult, if it's partners who are a caregiver and a person with one of these disorders, there are all sorts of other issues that could be going on, and some of them are really, really complicated. And it may be that you can get some help by talking to other people who are going through those experiences, and it may be that you can't get that kind of help from somebody, and it might be a good idea to seek out professional counseling in the event that you are just outmatched by the experience that you have. It's not an easy thing for everyone to do, but it is certainly worth considering if you find yourself in a situation where you are becoming more and more unhappy or dissatisfied or depressed, and you're not seeing a way out. You're not seeing solutions to the problem. Chances are you are going through an experience that many other people go through, and clinical psychologists probably have pretty good strategies for how to help people get to a better place for themselves in how they think about their life situation and how to better manage their life situation. So sometimes it's a good idea to sort of take stock and seek professional counseling also.
Mm. I think that's great advice, Sandy. And for those of you who don't have insurance for mental health benefits, a lot of the universities, like here at UT Southwestern, we have a family study center that's on a sliding scale. And I would think most cities or universities have some kind of sliding scale counseling. And if you're working, you may have employee assistance through your employer where you can get free counseling as well. And it's important for the whole family. Most of the time after we get past the acute period, or even when things are maybe more things are coming up later down the road, or we're about to have another transition, or there's been something's going on, I will suggest maybe it's a good idea for the whole family to go in, because as the dynamics change, or as people are concerned about the future, or different things happening, or my child's going to college, or my husband started a new job, we need to move, or whatever that may be, all of these things can kind of affect the dynamics of the family. And so it's not necessarily just for one person or the other, but maybe as a group to kind of have someone guide through and talk about the different things that could be there. And it's just helpful to have that opened up and brought into the light. Mm-hmm. And if you're working and you're a caregiver for your child or your spouse or your parent, you may be eligible for family medical leave. We do that a lot for patients to do intermittent leave. So maybe if it's hard for you to get off work, you can use your intermittent leave to go to these counseling appointments, or just to go be their emotional support for medical appointments. Or I would think your doctor's office would be happy to fill that out for you.
All of that, I think, is very valuable advice. I think it's important for all of us to remember that no matter how much you love your loved one with one of these diagnoses, that if you neglect yourself and you start falling apart, you're not helping them either. You're not helping your loved one if you're not helping yourself to do what you need to do to stay afloat and keep going. There was some question. We talk about all of these resources to support yourself as a caregiver, and we talk about support groups for patients. Sandy or Audrey or Catherine, do you know of any support groups that are maybe more specifically for caregivers, where you can come in a group setting and discuss with people with like experiences, whether that be through the TMA that they know about or otherwise?
Well, there are national organizations that are focused exclusively on the caregiver. The association has been associated with the National Family Caregivers Association for many years. And it was started by a woman whose husband has multiple sclerosis, and they always have they have a newsletter, they have a website, they have really excellent information for people. I am not aware of whether they have local support groups or not. But there are other organizations like those. We have different communications through our association that really allow people, like Smart Patients, for instance, that allow people to post about any topic they want to post about, and so they can start conversations that are related to anything, including caregiver issues. But I would suspect that there probably are groups locally, but I am not aware of those, Sam.
Mm-hmm.
I think same here. We don't have any specific ones just for caregivers. I think a lot of the caregivers will go with patients to the support group to hear the information, and certainly I would encourage people out there that if you see a need to start your own group, and just be sure that you are having support from the Transpersonal Alliance Association to help guide you. There is a website that I get their newsletter every week. It's caregiver.com, and they usually have really good stories and tips on balancing your life.
If I could make another point that it's somewhat tangential to this, but it's a point I wanted to make. Oftentimes, people who have these disorders, for a number of different reasons, find themselves shut off from relationships and friendships that they had for many years. And it could be for a whole host of reasons, from they're not able to do the things that they shared with friends in the past, like, different sporting activities, for instance, or they might have bowel and bladder issues, which make them very tentative about going out in a social environment. Or it's a pain in the neck to get around because of mobility issues. There are a whole host of reasons why people become shut off from very close friends that they've had for many years. A caregiver can get themselves. One of the hardest things a caregiver can do for themselves is get time. I took a week and a half vacation. It's the longest I've been away from Pauline since she got transverse myelitis 20 years ago. I went to visit a friend of mine in Montana who I hadn't seen in 36 years. And that was a fantastic experience for me. But I needed the time and the availability to be able to do that. Having your loved one reconnect with friendships it does something absolutely tremendous for them by reconnecting with people who really are important to them in their lives, and it gets you some time. So if you can do something to try to help facilitate those reconnections, I think you will find that those friends are very open to that kind of experience, and it would help your spouse or your partner by virtue of having them have a positive social experience, which some of them really need desperately, and it would get you some time for yourself.
Yeah, that's I think a very important point to make. Thank you, Sandy. As we round out the podcast here, I was hoping I could get some last words or thoughts from Sandy and Audrey and Catherine regarding support for the caregivers, how caregivers can help support their loved ones, and how they can better support themselves before we finish everything out. Audrey and Catherine, would you like to say some final words?
Sure. I think the biggest thing is just to communicate and ask. If there are things that you need or things that you're experiencing, reach out for resources, whether that be through your physician office, whether it be through your local support group, your family, where you may attend a religious service or something like that, but just ask. We are meant to be part of a community, and so if you find yourself slipping away, you or the person who is affected, just reach out and keep reaching out so that you can rebuild that community if it has been lost. But I applaud everyone who just kind of dedicates their lives to helping others and the sacrifices that are made. No one can really understand each person's journey because they're not in your shoes, but all of us who just help and try to support you all who do this work we honor you guys. It's just amazing to see the amount of love and support that is given. So just know that
it is with great gratitude that we say thank you to all of those who are caring for those who have been affected by these rare diseases. So thank you. Yeah, and I'll say thank you too. We're very grateful for that. And I think just like what Audrey's saying, just to communicate and so try to surround yourself with supportive people and positive people, and be kind to yourself. Learn that self-compassion, and I encourage you to do that self-compassion questionnaire and kind of see where you are. And don't second-guess yourself. You're making the best decisions you can. Trust your instincts, and just be honest. And, surround yourself with funny people, too. That helps a lot, too, to laugh a lot. And do something for yourself every day. Be good to yourself, whether it's taking a walk outside for a few minutes, whether it's just meditating for a few minutes and being mindful. Just take 10 minutes a day to do something for yourself, or just treat yourself to a coffee or something that makes you happy. And just remember that we all make mistakes, and we're all just doing the best that we can. And to reach out to resources. And again, you can call 211 and find out about resources that are available in your area.
Well, I'll just end by saying that I have probably learned more about human beings going through this experience through getting to know caregivers in this community who are about as selfless as anybody could possibly imagine in caring for people who they totally love, and what they have given up in their lives to really based on their love and care and concern for a person in their family has just been one of the most amazing parts of this experience for me. And one of the more gratifying aspects of that is watching people who give up so much out of the love that they have for a person still find ways to live their lives and be themselves and still find pleasure and enjoyment in their life in spite of what is an amazingly challenging experience for them.
Thank you, Sandy, and Audrey and Catherine as well for your time today, for sharing your experiences and expertise with the community. And thank you to all the listeners and your questions. And I want to point out that the TMA here is not just here to support patients and people with the diagnosis of TM, NMO, or ADEM, or any other of these rare diseases, but to support the whole family, caregivers and included. And want to remind everybody that this podcast is recorded and will be posted on myelitis.org shortly after the podcast is over today. And a reminder that there will be another podcast a month from now in December going over Understanding Transverse Myelitis, TM 101. So please be sure to ask your questions for that, and you'll hear from us again in a month. So thanks again, and hope everybody has a great rest of the week.